Hello, my name is Mona Dispani, and I'm going to be doing the blood glucose monitoring checkoff as well as the mixing the insulin with regular and in. First of all, introduce myself. My name is Mona Dispani. I'm going to identify my patient, and then I'm going to wash my hands, and I'm going to allow my patient to wash their hands because we're going to do the blood glucose check first, and I'm going to assess them for any hypo or hyperglycemic uh, symptoms. And I'm also going to make sure that they're getting ready to eat their meals prior to them getting their insulin, which would be 30 minutes prior to that. Then I'm going to put my gloves on. Put my gloves on. And next, I'm going to check my patient's blood sugar, check their hand. I'm going to stick their finger on the lateral aspect of their finger from the glucometer. I have my pen, but I'm going to be using this. I'm going to swab, which would be on the lateral aspect of their finger. Swab. And then I'm going to stick.
Your prodigy meter is on.
And
Please
get the
wait.
blood.
Please apply blood into the test. Goodbye.
And get the blood sugar. You're going to tell me what the blood sugar is. And once I see what the blood sugar is, then I'm going to follow the order according to the doctor's orders what the patient is supposed to have. Also, I'm going to give the patient a swab to swab their finger to help with to stop the bleeding. And next, I'm going to get rid of, save everything, take my gloves off again. I'm going to be taking my gloves off again, washing my hands again, so that way I can prepare the insulin. So next, I'm going to check my orders again, second time, against the MAR was orders for their blood sugar. And while I'm doing that, next I'm going to swab each bottle, the R, and then the N. And then I'm going to make sure I check my expiration dates for each one, making sure that it's current. Then once I use the bottle, I'm going to date it and initial it. First, I'm going to get the air for the R, which is 10. I'm going to be aspirating 10 units of air into the R. I've already swabbed my N. I'm going to aspirate 10 units of air into the N. Now I'm going to go back and get my 10 units out of the R. Making sure that I'm not having any bubbles appearing. Now I'm going to get the 10 units. This is 10 units of regular. I'm going to get the remaining units in the N. Making sure not to touch the bottle. And no air bubbles. Making sure there's no air bubbles in the syringe. This is 20 units combined of Humulin N and R. Now I'm going to go and administer the insulin in the abdominal area. I'm going to squeeze and stick and administer the medicine in slowly. And apply a little light pressure. Dispense of the needle into the sharps container. Make sure my patient is comfortable. Remove my gloves. And make sure everything is clean. Make sure my patient is comfortable. Wash my hands. Document everything that I've done as far as the amount of the insulin and the amount of his blood sugar. Thank you.